again. Thank you for coming to this second press conference of today, which is about the FIGO World Report 2012, Improving Women's Health, the document that you have received. If you have not, you can collect outside the room. We have already spoken about this very few words this morning. Let me introduce our honorable guest speakers, starting from Professor Sabaratman Arulkumaran, Sir Professor Sabaratman Arulkumaran, who is the President-elect of the International Federation of Obstetrics and Gynecology, FIGO. Dr. André Lalonde, who is the chair of the FIGO Committee for Safe Motherhood and Newborn Health. Dr. Francis Daysturk, who is the president of ICM, which is the International Confederation of Midwives. Dr. Mike Pizzo, who is the director of the Department of Reproductive Health and Research of the WHO, or World Health Organization. Finally, Dr. Wolfgang Utzgerebe, who is the FIGO representative to the WHO and the United Nations in Geneva, if that is correct, the title. Maybe you have many others, as our guest has many other titles. Thank you for coming to this press conference. Thank you to you all for participating. Professor Arulkumaran.
Thank you very much for giving the opportunity and for us to present this report. I'll give a brief introduction about the report. The first part is called Improving Maternal Health, and the second part is actually Improving Reproductive Health. The idea is actually we are focusing on maternal mortality in a big way. As you know, when the Millennium Development Goal 5 was postulated, there were about 546,000 deaths in 1990, and the plan was to bring it by 75% in 2015. The 2010 report says it's 287,000, so it's a massive reduction, about 47%, but still not exactly what we want to achieve. So the first part of the report is actually looking at how did these countries, because many of these countries are less resource countries, not rich countries, how did they manage to bring this maternal mortality down? And we have experts here who have been introduced already, who have written articles about how specific examples, how countries have done, or specific methods which has been utilized, or improvement in skilled care attendance, how this has improved the reduction of maternal deaths. The idea is actually those who are coming from different parts of the world can look at this report and use those case examples in order to improve the maternal health and reduce maternal mortality. If you carefully analyze the report, there are 5 principles underlying. Number 1 is that there must be a commitment by the government and the organizations. Number 2 is actually to give the responsibility to the people, the organizations, and so forth. Number 3, take some selected examples like postpartum hemorrhage or contraception or maternity coupons or something like that to improve. And number 4, to increase the effectiveness of the people, providers, for example. And finally, some sort of monitoring mechanism. The second part of the report is not to ignore the rest of the women who are not pregnant, but they have other problems, essentially in terms of unsafe abortion, fistulae, and cervical cancer, breast cancer, and so on and so forth. So we have got a series of articles there to see what's the latest in terms of improving care in these particular areas, which kills many people. For example, we are talking about maternal mortality, but there are 285,000 deaths due to cervical cancer, and there are 500,000 women who get cervical cancer. So how do we prevent that? And there are articles about low resource settings, also how we can improve the care so that we can prevent as well as treat cancer. So I'll stop there, and probably I will ask each of our panel members, because they have contributed an article to this series, so they will say a few words about those articles and then we can open it up for questions.
Thank you very much. I'm the head of the Committee of Safe Motherhood and Newborn Health, and we report on the experience of FIGO in conducting a project in 10 low-resource countries, 3 in Central and South America, 1 in Asia, 4 in Africa, and 2 in Central Europe. And in these projects, they were led by OBGYNs in collaboration in many countries with the midwives, and it was to reduce maternal mortality and morbidity. For example, in Uruguay, our project featured how to prevent unsafe abortion. And it started by having a woman arrested in a hospital because she came in after an unsafe abortion. And the physician and the midwives thought this was bad, and they formed this group, and we sponsored this group to educate the woman. They were able to change the rules in the country. And finally, at the dissemination meeting, the president of the country of Uruguay said no woman should die from unsafe abortion. And he named our project director as deputy minister to implement sexual reproductive health in the country. So this is one example, and there's many. In Uganda, they worked with women groups to gather money so that they would have funds available for transport, etc. So these are many projects that are listed in the report. And we also, the committee, were very active in promoting prevention and treatment of postpartum hemorrhage, and we created guidelines for that effect. Thank you.
Well, I was very pleased to have been invited by Sir Aogoi to participate in this and to take the opportunity to share with the wider community the outcomes and findings of the State of the World Midwifery Report. My co-author was Vincent Favre, who was a lead behind the development of this report. And the title is about making the world's midwives visible, because they were quite invisible in some countries, and unfortunately in the countries where midwives are needed the most. So, for those of you who are not familiar with the State of the World's Midwifery Report, it was launched last year, and it sets out the state of midwifery in 58 countries with the poorest maternal and newborn outcomes. Sir Aogoi talked about maternal mortality, and that's very important that we look at the women who die, but we also need to remember the women who suffer great morbidity, and that's almost 30 million women. So women who suffer from, for example, fistula or many other poor outcomes as a result of childbirth. The article talks about some of the areas in tackling the barriers, and it draws attention to the status of women and the status of midwives. We also draw attention to the importance of educating women and citizens so that they know how to access care and how to demand care. We talk about the huge gaps in human resources for health. And again, in the countries where midwives, nurses, and doctors are needed the most, they are there in very short supply. And we also talk about this sort of encouraging news with the reduction in maternal mortality, but the fact that we all need to work together to make sure that we make sure that women just do not keep dying when there are dying